So first, let me define what disability health equity is, because some people have heard of health equity, some people haven't. But disability health equity just means that people with disabilities have a fair opportunity to be as healthy as possible. It's not about giving special treatment. It's about removing barriers, because it's harder for people with disabilities to access healthcare. And then with healthcare also comes public services, information, housing, transportation, employment. So a lot of people think disability is about medical care, but health is shaped by our everyday systems, right? We're healthy if we can get out and walk, if we can get transportation to a doctor's appointment, if we can get to a job that provides us with healthcare that helps us achieve health outcomes. Globally, about 1.3 billion people have a significant disability. That's about 16% of the global population. Here in the US, the Centers for Disease Control and Prevention, or CDC, reports that more than 1 in 4 people have some sort of functional disability. So we're talking about a lot of people, a significant part of the US population and the global population. The challenges, or the problem that we're trying to address, is that people with disabilities around the world and here in the US tend to have poorer health conditions, and that means they're more likely to die earlier. They have a higher risk
of affected with their disability, and some of it is not, right?
It's a both and, correct? Because so just to put a fine point on it, people with disabilities are more likely to die younger, as much as 10 to 20 years younger than people without disabilities. They have a higher risk of chronic conditions like diabetes, depression, obesity, smoking, which is a habit, but also causes disease. And also they face a lot of environmental and social barriers. So it's a global health priority, right?
Right.
We need to be talking about it.
And we've talked about, one of the reasons why we emphasize employment here at Save Disabilities so much, because times with employment comes healthcare and things.